Namaskar, welcome to PK's classes. Today we'll study classification of anti-tubercular drugs. So tuberculosis is caused by Mycobacterium tuberculosis. So the drugs used against Mycobacterium tuberculosis are called as anti-tubercular drugs. And for details you can refer to earlier classes on tuberculosis. The links are attached in this video. So the classification, we can have first line drugs and second line drugs. First line means drugs of first choice, second line means drugs of second choice. And why they are drugs of first choice, first line drugs? Because they are safe and efficacious. And again, first line, initially there were 5 first line drugs, but now only 4 are available as essential drugs. So first line essential drugs, because they are most effective and they are the basic components of any anti-tubercular drug regimen. And the 5th drug, streptomycin, is now used as the first line supplemental drug because of its toxicity. And the first line essential drugs, 4 first line essential drugs are there. They are isoniazid or isonicotinic acid hydrozide, rifampicin, pyrazinamide and ethambutol. The first line supplemental drug, which is kept as a reserve drug, which is used in special settings, that is streptomycin. Now the second line drugs, these are the drugs of second choice. Why they are drugs of second choice? Because they are less effective and slightly more toxic than the first line drugs. And when we can use these second line drugs, they are used when there is resistance to first line drugs, then when there is contraindication to first line drugs for some reason we cannot use them, and if there is failure to first line drugs, or if there is severe unwanted reaction to first line drugs, then only we use the second line drugs. When we use the second line drugs, we must have the expert guidance. The doctor should be available to deal with the toxic effects of the second line drugs, as they are more toxic than the first line drugs. And the second line drugs include the fluoroquinolones like moxifloxacin, gotifloxacin, levofloxacin, the aminoglycoside antibiotics like amikacin, kanamycin, then the cyclic peptide antibiotics like capreomycin, viomycin, enviomycin, then the thioamides like ethionamide, prothionamide, the macrolide antibiotics like clarithromycin, azithromycin, and then some new group of drugs like diaryl quinolines, example bedaquiline, then the nitrodihydroimidazoxazoles, in short we can call them as nitroimidazoles, example delamanid, pritomanid, then benzothiazinones, example macogenone and 8-nitrobenzothiazinone. So these are these 3 group, that is diaryl quinoline, nitroimidazole and benzothiazinone. These are the 3 newer drugs available now for tuberculosis. And some less effective drugs are now there. There are some old drugs as well as some new drugs are also there. So first we will discuss the beta-lactam antibiotics. Beta-lactam antibiotics, the penicillins, that is amoxicillin, in combination with the beta-lactamase inhibitor or suicidal inhibitor, that is clavulanic acid. Then the carbapenems, again a new group of beta-lactam antibiotic used, which has shown efficacy against tuberculosis, that is tebipenem. Then the next is para-amino benzoic acid derivative, that is para-amino salicylic acid. Then some structural analogues of D-alanine, the amino acid, which can be used as antibiotic inhibiting cell wall synthesis, the peptidoglycan biosynthesis, like cycloserine, and a recent drug teriridone, which is a prodrug of cycloserine. These are the examples in this group. Then the thiosemicarbazone derivatives like thiacetazone. Then another group of drugs with efficacy against tuberculosis is the oxazolidinediones or oxazolidinones like linezolid, sutezolid, radezolid, tedizolid. Then the rifamycin derivatives like rifabutine, rifapentine, which are preferred over rifampicin in certain settings. Then finally the riminophenazines, the phenazine derivative, clofazimine, which is also having efficacy against leprosy. So these are all the second line drugs, and that's all about the classification. Thank you.